A clinical medical assistant is preparing a patient for a 12-lead EKG. The patient is diaphoretic and the electrodes are not adhering properly. Which of the following actions should the assistant take? A. Use alcohol to clean the skin and allow it to air dry before placing electrodes. B. Apply talcum powder to reduce moisture. C. Skip leads that do not stick and proceed with the test. D. Reposition the patient to a seated position to reduce sweating. Answer A. Alcohol effectively removes oils and moisture from the skin and enhances electrode adhesion. Allowing it to air dry ensures proper conduction without interfering substances. Talcum powder interferes with electrode contact. During a routine urinalysis, a clinical medical assistant observes that the specimen appears cloudy and has a strong ammonia odor. What is the most appropriate action? A. Discard the sample and ask for a new one. B. Continue with dipstick testing and document appearance. C. Refrigerate the sample and retest in an hour. D. Warm the sample and then test for protein. Answer B. Cloudy urine with a strong ammonia smell often means infection or dehydration. Testing should continue and be documented. A provider instructs a CCMA to administer an intramuscular injection to a 6-month-old infant. Which site should the assistant choose? A. Ventrogluteal. B. Dorsogluteal. C. Deltoid. D. Vastus lateralis. Answer D. The vastus lateralis is the preferred site for intramuscular injections in infants because it has a thick muscle mass and is free of major nerves and blood vessels. A clinical medical assistant is reviewing a patient's history and sees that the patient is allergic to latex. What should the assistant do before administering a blood draw? A. Proceed with standard gloves unless a rash appears. B. Confirm allergy and use nitrile gloves and latex-free supplies. C. Document allergy but use regular supplies for quick procedures. D. Ask the provider if the allergy is still active. Answer B. Allergies to latex can be severe. The assistant must use latex-free alternatives to prevent anaphylaxis or allergic reactions. Documenting and adjusting equipment are both critical safety steps. A CCMA is obtaining a blood sample for lipid profile testing. Which instruction should be given to the patient prior to the test? A. Avoid dairy products 6 hours before the test. B. Consume a high-protein meal the night before. C. Fast for at least 12 hours prior to testing. D. Drink plenty of water 2 hours before the test. Answer C. Fasting for 12 hours is essential to obtain accurate lipid profile values, especially triglycerides, which are affected by food intake. A clinical medical assistant is preparing to record the pulse oximetry of a patient with cold fingers. What should the assistant do to ensure accurate readings? A. Place the probe on the index finger and wait longer. B. Warm the patient's hand and place probe on the earlobe. C. Use the probe on the foot regardless of temperature. D. Apply petroleum jelly to improve contact. Answer B. Cold fingers can cause poor circulation and affect pulse oximeter readings. Warming the hand and/or using an alternative site like the earlobe provides more reliable results. A patient who recently immigrated from another country presents with a persistent cough and night sweats. What should the CCMA do first? A. Notify the provider immediately. B. Ask the patient to wear a mask and isolate them. C. Record symptoms and wait for the provider's instructions. D. Provide cough syrup and reschedule. Answer B. Night sweats and persistent cough may indicate tuberculosis. Airborne precautions must be followed immediately to protect staff and patients from exposure. During a capillary puncture procedure, blood flow is slow and clotting begins. Which of the following actions should the CCMA take next? A. Apply pressure and bandage the site. B. Squeeze the finger firmly to increase flow. C. Wipe away the first drop and warm the hand. D. Switch to a venipuncture instead. Answer: C. Warming the hand increases blood flow by dilating blood vessels, and wiping the first drop removes tissue fluid contamination. Excessive squeezing can lead to hemolysis. A CCMA receives a critical value for a potassium level of 6.8 milliequivalent/L while reviewing lab results. What is the appropriate next step? A. Schedule a follow-up appointment for the next week. B. Immediately notify the provider. C. Ask the lab to repeat the test. D. Call the patient and inform them of the result. Answer: B. A potassium level of 6.8 is dangerously high, hyperkalemia, and can lead to cardiac arrhythmias. It must be reported to the provider immediately for urgent action. A CCMA is performing an EKG and notices artifact on the tracing due to somatic tremor. What is the appropriate intervention? A. Re-clean the electrode sites with alcohol. B. Ensure the patient is not cold and is relaxed. C. Move the patient to a prone position. D. Tighten the EKG machine cables. Answer: B. Somatic tremors are caused by muscle movement or shivering. Ensuring the patient is warm and calm helps reduce this artifact. A clinical medical assistant is instructed to obtain a blood sample for a complete blood count, CBC. Which tube should be used? A. Light blue top. B. Green top. C. Lavender top. D. Red top. Answer: C. The lavender top tube contains EDTA, an anticoagulant that preserves the blood cells for analysis, making it the correct choice for CBC testing. When instructing a patient about a 24-hour urine collection, what is the correct protocol the CCMA should emphasize? A. Discard the first urine specimen, then collect all urine for 24 hours. B. Collect only the first and last samples within the 24-hour period. C. Keep the specimen in a warm environment. D. Drink only 8 ounces of water during the collection period. Answer: A. The first urine sample is discarded to begin the 24-hour timing accurately. All subsequent urine must be collected and stored properly. A CCMA is teaching a patient about wearing a Holter monitor. Which instruction is correct? A. Remove the device before taking a shower. B. Stop all physical activity during monitoring. C. Keep a diary of symptoms and activities. D. Adjust the electrode placement if discomfort occurs. Answer: C. Patients must maintain a log of symptoms and activities during Holter monitoring to correlate events with the recorded ECG data. When preparing a patient for a minor surgical procedure in the office, the CCMA should use which of the following techniques to maintain surgical asepsis? A. Touch sterile field only when gloved. B. Use alcohol-based hand sanitizer over gloves. C. Clean the site with soap and water. D. Wear a surgical mask only. Answer: A. Only sterile gloves may touch a sterile field to maintain asepsis. Any breach contaminates the field and requires replacement of supplies. A clinical medical assistant is reviewing the EHR and notices a provider left a note that seems inaccurate. What is the proper course of action? A. Delete the entry and rewrite it. B. Contact the patient directly for clarification. C. Alert the provider discreetly for review. D. Edit the note and initial the correction. Answer: C. Only the provider can amend their documentation. The CCMA should discreetly notify the provider to review and correct the record if needed. A CCMA measures a patient's blood pressure as 180/110 mmHg. What should the assistant do next? A. Wait 10 minutes and retake the BP. B. Notify the provider immediately. C. Instruct the patient to relax and return in 1 week. D. Document the reading and move to the next patient. Answer B. A reading of 180/110 is hypertensive crisis range. It requires immediate provider attention to prevent risk of stroke or cardiac events. Which of the following actions should a CCMA take when labeling blood specimens in a hospital setting? A. Label each tube after leaving the patient's room. B. Label tubes in the presence of the patient immediately after collection. C. Use initials only for confidentiality. D. Allow the patient to label their own tubes. Answer B. Proper labeling must be done immediately in the presence of the patient to ensure accurate identification and prevent specimen rejection. A provider prescribes a 250 mg IM injection of medication. The available medication is 500 mg per milliliter. How much should the CCMA administer? A. 0.25 milliliters. B. 0.5 milliliters. C. 1 milliliter. D. 1.5 milliliters. Answer B. To calculate, 250 mg divided by 500 mg per milliliter equals 0.5 milliliters. The CCMA should administer 0.5 milliliters. Which of the following best describes the proper method to clean an EKG machine after a patient with a suspected contagious skin infection? A. Use alcohol wipes on electrodes only. B. Disinfect with EPA-approved solution on contact surfaces. C. Rinse the wires in soap and water. D. Sterilize the entire machine. Answer B. Contact surfaces of equipment must be disinfected using EPA-approved solutions to reduce the risk of cross-contamination. A CCMA is documenting a patient's chief complaint. Which of the following entries is correct? A. The patient has been having stomach problems for weeks. B. Patient says she has had nausea for 3 days. C. Nausea for 72 hours and seems severe. D. States feels sick and probably has the flu. Answer B. The chief complaint should reflect the patient's own words, usually introduced with patient states or patient reports. A patient with a hearing impairment is scheduled for an office visit. Which communication method should the CCMA use first? A. Use hand gestures exclusively. B. Speak slowly while facing the patient. C. Shout instructions clearly. D. Write instructions without verbal communication. Answer B. Speaking slowly and clearly while facing the patient enhances lip reading and nonverbal cues, which supports communication. Which of the following is a CLIA waived test that a CCMA may legally perform? A. Hematocrit manual testing. B. Cholesterol by venipuncture. C. Fecal occult blood test. D. Peripheral blood smear. Answer C. Fecal occult blood tests are considered CLIA waived and may be performed by trained medical assistants in clinical settings. A provider prescribes amoxicillin 500 mg POTID for 10 days. How many capsules will be dispensed in total? A. 20. B. 25. C. 30. D. 35. Answer C. TID, 3 times daily, for 10 days equals 30 doses. Therefore, 30 capsules are needed. Which condition may result from repeated venipuncture on the same vein? A. Thrombosis. B. Polycythemia. C. Hypoxia. D. Hemoconcentration. Answer A. Repeated punctures can damage the vein and lead to clot formation, thrombosis, making future access difficult and causing complications. A CCMA notices a coworker accessing the EHR of a patient they are not treating. What is the appropriate response? A. Report the incident to the supervisor. B. Ask the coworker for clarification. C. Ignore the behavior unless it repeats. D. Tell the patient what occurred. Answer A. Unauthorized access of patient records is a HIPAA violation and must be reported to the appropriate supervisor or compliance officer. A CCMA receives a call from a pharmacy requesting clarification on a prescription. What is the correct action? A. Provide the information if it's clear. B. Refer the call to the provider. C. Cancel the prescription. D. Tell the patient to call the pharmacy. Answer B. Only licensed providers may clarify or modify prescriptions. The CCMA must refer such calls to the provider. A CCMA is assisting a provider during a pap smear. Which instrument should be handed to the provider? A. Curette. B. Vaginal speculum. C. Tuning fork. D. Reflex hammer. Answer B. A vaginal speculum is used to visualize the cervix during a pap smear. The other tools are not relevant for gynecologic exams. Which of the following is the first step in the blood collection process using the evacuated tube system? A. Anchor the vein. B. Insert the needle. C. Apply the tourniquet. D. Clean the site. Answer C. The tourniquet must be applied first to locate and assess the vein before cleaning and venipuncture. A CCMA is reviewing a patient's chart and sees the abbreviation PRN. What does it mean? A. As needed. B. After meals. C. Before bed. D. Daily. Answer A. PRN stands for pro re nata, which means as needed in medical terminology. What position should a patient be placed in for a rectal temperature measurement? A. Fowler's. B. Lithotomy. C. Sims. D. Supine. Answer C. Sims position provides optimal access to the rectum for safe and comfortable temperature measurement. A patient scheduled for spirometry should be instructed to avoid which of the following before the test? A. Drinking water. B. Smoking for at least 1 hour. C. Lying down for extended periods. D. Using a nasal cannula. Answer B. Smoking can affect lung function and should be avoided before spirometry to ensure accurate test results. Which injection route should a CCMA use when administering a purified protein derivative, PPD, test for tuberculosis? A. Subcutaneous. B. Intramuscular. C. Intradermal. D. Intravenous. Answer C. The PPD test is administered intradermally to monitor for a skin reaction indicating exposure to tuberculosis. The appropriate angle for needle insertion during venipuncture using the evacuated tube method is A. 15 to 30 degrees. B. 45 to 60 degrees. C. 5 to 10 degrees. D. 60 to 75 degrees. Answer A. The proper angle for safe and effective venipuncture is between 15 and 30 degrees, depending on the vein's depth. A patient collapses in the lobby. After ensuring the scene is safe, what should the CCMA do first? A. Begin CPR. B. Call 911. C. Check responsiveness and breathing. D. Check glucose level. Answer C. According to BLS guidelines, the assistant should assess the patient's responsiveness and breathing before taking further action. Which type of scheduling method assigns patients to the same time block for group treatment or education? A. Cluster booking. B. Wave scheduling. C. Double booking. D. Open scheduling. Answer A. Cluster booking allows for efficient scheduling of patients with similar needs, such as education sessions or follow-ups. A CCMA is reinforcing teaching with a patient who is scheduled for a cardiac stress test. Which instruction should be included? A. Eat a full breakfast on the day of the test. B. Avoid caffeine for at least 3 hours before the test. C. Wear tight-fitting clothing. D. Take all medications without exception. Answer B. Caffeine can alter heart rate and blood pressure, potentially affecting test results. It should be avoided prior to stress testing. A provider asks a CCMA to assist in a sterile procedure. What must the assistant do before donning sterile gloves? A. Apply hand sanitizer. B. Remove the gloves from the outer package. C. Perform a surgical scrub. D. Wash hands thoroughly with soap and water. Answer D. Hand hygiene with soap and water is essential before putting on sterile gloves to reduce contamination risk. A CCMA needs to prepare a patient for an EKG. What should be done to ensure artifact-free tracings? A. Ask the patient to hold their breath during the test. B. Ensure proper skin prep and electrode contact. C. Record the test while patient is seated. D. Avoid removing jewelry. Answer B. Proper skin prep and electrode placement are critical to avoid motion or interference artifacts in the EKG tracing. A patient is undergoing cryosurgery for cervical dysplasia. What post-procedure instruction should the CCMA give? A. Expect heavy bleeding for 5 days. B. Avoid sexual activity for several weeks. C. Take antibiotics for 10 days. D. Resume normal activities immediately. Answer B. After cryosurgery, patients should avoid intercourse, tampons, and douching for 2 to 3 weeks to allow proper healing. A CCMA receives a critical lab result for a patient who has already left the office. What is the appropriate next step? A. Call the patient directly and explain the result. B. Leave a message with the result on voicemail. C. Notify the provider immediately. D. File the result in the chart for the next visit. Answer C. Critical lab results must be reported to the provider right away so that urgent care decisions can be made. Which of the following routes allows the fastest absorption of medication? A. Subcutaneous. B. Oral. C. Intramuscular. D. Intravenous. Answer D. For administration delivers medication directly into the bloodstream, providing immediate absorption and effect. A CCMA is asked to collect a sputum specimen from a patient. What is the best instruction to give? A. Collect the sample immediately after meals. B. Rinse your mouth with mouthwash before collection. C. Provide the sample first thing in the morning. D. Avoid coughing when providing the sample. Answer C. Morning sputum specimens are more concentrated and provide more accurate diagnostic material. When sanitizing instruments for use in an autoclave, the CCMA must A. Dry them completely. B. Use only alcohol to clean them. C. Submerge in bleach for 5 minutes. D. Scrub to remove all organic matter. Answer D. Proper sanitization requires thorough cleaning to remove blood and tissue before sterilization in the autoclave. A CCMA is asked to assist with a nebulizer treatment for a pediatric patient. Which of the following should the assistant do? A. Use a nasal cannula instead of a mask. B. Instruct the child to hold their breath during treatment. C. Monitor the child for signs of respiratory distress. D. Dilute the medication with normal saline. Answer: C. Monitoring for respiratory distress or adverse reactions is critical during nebulizer therapy, especially in children. Which of the following documentation templates is organized by the patient's symptoms? A. SOAP. B. Cheddar. C. SOMR. D. POMR. Answer: D. The problem-oriented medical record, POMR, is structured around a patient's specific problems and symptoms. What should the CCMA do if a patient refuses a treatment or procedure? A. Inform the patient this could result in discharge. B. Record the refusal and notify the provider. C. Attempt the procedure again later without consent. D. Document the refusal but continue the treatment. Answer: B. Refusal must be documented and the provider informed. The patient has the right to refuse care at any time. A CCMA is performing a capillary puncture on an adult patient. Which site is preferred? A. Earlobe. B. Heel. C. Thumb. D. Ring finger. Answer: D. The ring, or middle, finger is typically used for adult capillary puncture due to ease of access and low risk of complications. When performing an ear irrigation, how should the CCMA position an adult patient's ear? A. Pull pinna down and back. B. Pull pinna up and back. C. Tilt the head forward. D. Lay the patient supine. Answer: B. For adults, the ear is pulled up and back to straighten the ear canal and facilitate proper irrigation. The purpose of inverting a tube containing an anticoagulant additive is to: A. Break the clot. B. Prevent hemolysis. C. Mix the blood and additive. D. Warm the sample. Answer: C. Inversion ensures proper mixing of blood with the anticoagulant, preventing clotting and ensuring accurate test results. A CCMA is preparing a 5-year-old for a vaccine injection. What is the best approach? A. Explain in complex terms to distract the child. B. Tell the child it will not hurt. C. Use a calm, honest explanation with age-appropriate language. D. Avoid discussing the procedure beforehand. Answer: C. Honest, simple communication helps reduce anxiety and build trust with pediatric patients before procedures.